Now, one way we actually get indicators of the social licence is to actually ask surveys. And ask surveys about opinions, surveys about what people think about the impact of alcohol in their community, not necessarily asking surveys about your behaviour, but really asking them, what do you think about? What is your attitude towards? What if? And in this case, what we were interested in, as you can probably guess by now, is the role of alcohol in sporting contexts. VicHealth is very interested in that because we fund sporting associations to do good, to actually make you fitter and happier, for actually your sporting club to be welcoming for the women in your family. We want that because the more connected you are to the social and cultural institutions that you belong to, the healthier you are. That's our job. So why would we want to actually fund sport to do good on one hand, but then to actually engage in commercial sponsorships, advertising practices, relationships and commercial relationships with alcohol that actually undermine that? Seems a little bit at odds with each other. And that's the tension we feel. So one of the things we wanted to do was to talk to people and say, what do you want from your sporting club? What will make your sporting club a healthier, happier place? What do you want? What's your expectation about the role of alcohol in your sporting club, given that we know how important they are in terms of sponsorships and advertising? Thanks. Now, when we asked an open-ended question and said, what is the most unhealthy, as we asked two questions, what's the most healthy aspect of your club? And we asked the second question, which was, what's the most unhealthy aspect of your club? Open-ended question, no fixed choices. The highest response, up to 30% of respondents said alcohol consumption was the most unhealthy aspect of their sporting club. Now, this took us by surprise. We didn't actually think that that would happen. We thought with, people's focus on, overbearing parents or the code of conduct or things like that, that would be the main thing. But no, it was actually alcohol consumption. Next, thanks. We asked a series of other questions, and over 90% agreed that it's the club's responsibility to promote responsible drinking. About 7 out of 10 agreed that clubs would be more family-friendly if less alcohol was sold and consumed. 40% opposed alcohol sales. 55% opposed alcohol sponsorship. And about 8 out of 10 saw no difference in their participation if alcohol sales reduced at their club. 83% said they would support the removal of alcohol sponsorship from clubs if help was given to replace the lost revenue. 76% would support a levy on alcohol advertising if funds generated were allocated to community sports. Now, this is a measure of the social licence. It's not going to be the be-all and end-all, and these are people who, when they're asked about alcohol in relation to their sporting club, and clearly what we need to do is actually ask about alcohol in other contexts as well. But these are the kind of things that we need to think about. And more than a third said that they indicated there's too much alcohol in sports clubs. Next, please. Now, if anyone wants to look, they can look at those community attitudes survey in a report on the VicHealth website. We looked at this initiative itself as a campaign. So we thought about stakeholders, we got media attention, we produced fact sheets and reports. We tried to do the integrated approach that we talked about earlier. And one part of that integration was that we said, well, we know what the community is starting to tell us, that there seems to be an intolerance towards alcohol that we kind of haven't picked up before. So what we decided is we designed a thing called the Healthy Sporting Environments Demonstration Project, where we got 100 sports clubs down in the Geelong region, and we've invited them to join in a program of $2 million spending over two and a half years where we actually support clubs both financially but also through the provision of staffing to actually reach some minimum standards around a healthy sporting club. One of those is actually around alcohol, but clearly the minimum standards actually are related to each other. And I think looking at the program, when we, in part of the program today, sort of picks up some of the diversity of interrelating factors that can affect each other at a sporting club. So here we actually said, listen, we have to actually make sporting clubs safe and inclusive for women. We can't tolerate really cricket clubs where women aren't welcome, where it's a boys-only space where you just get up to hijinks and shenanigans. That wouldn't it be better, more healthier, more productive, where it's a safe and inclusive place? Oh, by the way, so that's going to be a minimum standard on safe and inclusive environment. What we should also do is have a minimum standard around what we do about alcohol. So in terms of the alcohol standard that we're asking clubs to reach. So here it's to reach Good Sports Level 2 accreditation, not selling or providing alcohol before midday on match days, displaying health promotion messaging of equal weighting to the branding and messaging provided by alcohol industry, and also selling spirits at an additional 20% premium on 2018 prices, and full-strength beer at an additional 10% premium on 210 prices, or only serving beer and spirits with an alcohol content of not more than 3.5%. So basically moving towards mid-strength beer at sporting clubs. But doing that integrated with creating safe and inclusive environments for women, doing that in terms of other minimum standards as well. Integrated approach. Next, please. Now I'm going to finish my presentation with a data set. Now I know there's some people who are allergic, so listen, we're just going to have to deal with that. People sitting next to them, just hold them, comfort them, because some people just don't like graphs. Now this is a graph from what they call the household expenditure data from the Australian Bureau of Statistics. Oh, it is working, sorry. This is a time series that goes from 1960 through to 2010, and it's from the national accounts of the ABS. And you can actually download the file from here. It's an Excel spreadsheet. It's if you're econometrically inclined, it's again a Saturday night special, which is a terrible appropriation of the word. Now, from 1960 to 2010, what it actually shows is the expenditure in millions. So this is thousands of millions. So this is gross expenditure across Australian households in the red line, tobacco expenditure. Tobacco expenditure, which actually peaked around here, and then with the onset and introduction of of tobacco taxation and large expenditure on social marketing, that you see this quite rapid and pronounced decrease in tobacco household expenditure across Australia. What we also see across the same time course is the household alcohol expenditure increasing. Now, I'm sure many of you in the room would agree with me that that's not a trend we want to see continue. And if there's anything that says to us that we need to make material changes in how we deal with the culture of alcohol consumption, then this is one material change that I'd like to see put into effect as soon as possible. Thanks very much.